There are many diagnostic tests that we use to diagnose coronary heart disease. The standard treadmill stress test, which can be upgraded with an echo or with nuclear imaging, has been around for many decades and is still utilized to determine the severity of someone's heart disease. What we found, though, is that in many cases, the stress test will be completely normal and the person can still have a heart attack or the development of significant angina because they have a cholesterol accumulation in the artery that was not large enough to be detected by the stress test. And in fact, these smaller cholesterol accumulations, called cholesterol plaques, actually account for 70% of heart attacks. So the cholesterol blockages that are 70% or more, the ones that can be picked up by a stress test, really only cause the minority, or approximately 30% of heart events. So how do we pick up the cholesterol accumulations that are not detectable on a treadmill? Well, we use a coronary calcium score test, which is a CAT scan of the coronary arteries to determine how much calcium has been deposited in the arteries. Calcium goes to the coronary arteries only when there's cholesterol there, and studies over the last 15 years have shown that the more calcium in the heart, the higher the likelihood of having a cardiac event. And this calcium has nothing to do with the calcium that we take as supplements, but rather is calcium that the body puts down in reaction to the cholesterol within the coronary arteries. There are also imaging tests like carotid Doppler tests and ankle brachial index, looking at the circulation in the carotid arteries and the circulation in the legs.